The main goal of the National DPP Lifestyle Change Program is to help participants make and keep new healthy habits that will help them prevent or delay type 2 diabetes. When recruiting eligible participants, it is important for you to convey the risks associated with prediabetes and type 2 diabetes and how the program can help them overcome their risk. However, meeting some of the eligibility requirements of the Diabetes Prevention Recognition Program, or DPRP, can be challenging, such as identifying participants with prediabetes. Participants must have a recent blood-based test indicating prediabetes, a history of gestational diabetes mellitus, GDM, or a positive screening for prediabetes based on the CDC or American Diabetes Association risk test. You can recruit participants for your program by getting referrals from healthcare providers, leveraging existing relationships with employers who cover the Lifestyle Change Program as a health benefit, and engaging your community. There are many ways to recruit.
The methods that are used typically are web inquiries that we have at the web page. Secondly, we have recommendations that come from physician groups. Thirdly, corporations may already have in place that they would like to bring the program there, so that's a natural opportunity. We have in our 18 full-service facilities, we have posters and signage and brochures, so when people call from the public, we're able to send a brochure immediately to them digitally about what the program is about. Lifestyle coaches can also accompany the program coordinator to local health fairs. They can also accompany them to giving speeches and presentations at corporations who are asking about this topic. And so, but definitely they go to health fairs, and we have brochures, we have flyers, posters, everything there for them to be able to distribute to anyone who walks by.
You should also identify champions for your program, like alumni and healthcare providers. Ask alumni to recommend your program to friends, family, and others, and also invite them to share their experiences as guest speakers in your sessions. To strengthen your relationship with healthcare providers, keep them in the loop on the progress of participants they referred. Make sure all information transmitted regarding a participant is in line with HIPAA, the Health Insurance Portability and Accountability Act. Continual communication and engagement with healthcare providers is essential to build trust and can lead to more referrals. Healthcare providers are also encouraged to ask participants how they are doing and reinforce the importance of sticking with the program. And because health fairs and community awareness events are filled with potential participants, get involved. Become a presenter. Reach out to places like schools, faith-based institutions, local clubs, work sites, even fast food restaurants. Nurture partnerships and leverage existing awareness days like American Diabetes Association Alert Day in March. Be sure to hand out marketing materials and, as first steps, refer your audiences to the CDC prediabetes risk test and encourage them to get a blood test. Another great recruiting strategy is holding an introductory or information class before the first session. We refer to this as Session 0. It gives you a prime opportunity to screen participants for program eligibility and explain the program, such as expectations, requirements, and the time commitment. It's also a great forum for answering questions and gauging motivation. Then, you can end the session by enrolling new participants.
When we do a Session 0 ahead of the program start, the Session 0 really starts allaying many of the fears or helps to correct some of the thinking when they think they're coming into this session. For example, if they think we're going to be exercising 1 hour every week, we dispel that myth right up front. Secondly, we go ahead and approach the subject that you'll be weighed in every week. That is another scary thing for some people. So we go ahead and frame it by saying, but the weigh-ins will be very private, and orientations, I think it's important to at least approach some of the research finding behind why this method is superior than just doing a little modification here. You have a long-term support. It's a year long. Sometimes you have to sell that. Why is it so long? Because it takes that long to modify behavior, really.
It's also important to recruit enough participants because chances are some participants will drop out.
It's awfully hard again for behavioral change, and so you will generally have attrition. So if we don't begin with at least 8, If you have attrition of 2 or 3, you're down to 5 with the 8. But if you begin with 4 or 3, you could in essence have coaches showing up with no one present.
Having enough participants also gives everyone in the group a larger support system and lets them know they're not alone in their journey to prevent or delay type 2 diabetes. As a lifestyle coach, you're never alone either because CDC is always here to help. To learn more, watch the rest of the Lifestyle Coach series and visit CDC's National DPP website. If you have any questions, just send an email to dprask@cdc.gov. Once you've recruited enough participants and your lifestyle change program is underway, you need to make sure they keep coming to sessions and stay in the program for the full 12 months. The second 6 months are an especially critical time because this is typically when some participants drop out.
The strategies we use to keep people engaged in the DPP program, there's a variety of tools that have to be used, we think. One of the major tools is follow-up phone calls. If someone doesn't come to a class and we let a second opportunity go, that they're not there, we've missed something major there. There are things that make them stay, and that is when we ask each other, I missed you last week. Something come up? You hadn't been here for 2 weeks. What's going on? And at least pick up a phone and call them and say we missed them. Now, in the post-course sessions, I like to do a build-up of that as I'm ending the course sessions, the first 16 weeks. Now we're going to be moving to meeting every other week, coming up here at the end of the 16th weeks. So I'll be seeing y'all in 2 weeks, and we'll be doing this for about 6 weeks. Now after that, we'll be meeting monthly. And I know that you've seen the value of us being together. So it's even more important, since we're meeting less, that we're coming. But if they don't come, if we don't follow up, we've missed our opportunity in my view. And it takes time. It just takes time to stop our day and say, that one was not there, I need to call.
Fostering group relationships makes a big difference too. Encourage participants to form support groups that meet outside of class where they can discuss eating habits, exchange recipes, share coping strategies, or be physically active together. And when you can, join them.
The other piece that is important is when we are monitoring what they're doing in terms of the exercise piece and that they're doing so well and they're meeting as groups sometimes, that we join them. The coaches join them anytime they can. It's not necessary. We don't mandate that. But anytime they can be with the group to facilitate, again, social cohesion. I'm of the view the success for us as coaches is building social cohesion. I call it the stickiness factor, what makes people stick and stay in groups.
A support group can also be the tipping point in getting someone who's been missing classes to come back. This is because it gives them a sense of responsibility to one another. Make sure you give continual feedback and encouragement on progress in a private, individual way, and give extra attention to participants who seem to be struggling. Creating a network of lifestyle coaches can be a huge help with this because you can discuss challenges and barriers with other coaches and learn how they've approached similar issues. An easy way to set up a network is by connecting with the coaches you met during your training. The more you learn about helping participants overcome personal struggles, the better you'll be at helping them be successful.
Our coaches, we like to have meetings on a regular basis, and some of our coaches, fellow coaches, want to develop their own support system, and our program coordinator is like, go for it. Anything to help you feel connected to each other in this mutual goal that we have. Also, at the state level, we have many people who want to see this type of program succeed along our state to help better our outcomes. And so there are a lot of extended communities that are out there, and you could stay busy with that far more than even the classes. There are so many that are valuable resources that we have to work with. Smaller organizations may not have the type of support we do from the national level, but the best support I feel a smaller organization can get is to become acquainted with the physician champion in their community.
Offering low-cost incentives like food measuring tools, stretch bands, or pedometers can also work wonders. But doing this is up to each lifestyle coach and organization. For example, Linda offered her participants gym memberships during the Get More Active module.
Another way we try to keep people engaged in the DPP program is at the 5th week. It's called Move Those Muscles. That's the name of the lesson. And so we are looking to give them a chance and a place to go move their muscles. So we give a 12-week membership to last between week 5 and week 16, so they have a place to go move their muscles.
If someone misses a class, be sure to schedule a makeup session. The makeup session can be held in any delivery mode, but needs to be approximately an hour and cover the missed CDC-approved module. Better yet, try to remove barriers to missing classes to begin with. This can involve anything from arranging transportation for participants to finding child or elder care for them. Despite your best efforts, at times personal issues can cause people to leave your program. When this happens, suggest re-entry into a future program or refer them to another program and follow up with them. As you've heard, there are many ways you can keep participants engaged and in the Lifestyle Change program to help them prevent or delay type 2 diabetes. To learn more, watch the rest of the Lifestyle Coach series and visit CDC's National DPP website. If you have any questions, just send an email to dprask@cdc.gov. To meet the requirements of the Diabetes Prevention Recognition Program, or DPRP, you need to document each participant's weight and physical activity at every session they attend. Carefully monitoring these measures over the year-long program can assist you in helping individual participants meet their goals. While the DPRP sets specific requirements for weight loss and physical activity, individual goals may vary. While weight can be self-reported, it's important to handle in-person weigh-ins with privacy and a sense of security. To achieve this, consider having weigh-ins in a separate room, using privacy screens, or communicating weight with sticky notes. Participants should use their fitness log each day to track their minutes of activity, then show it to you at the beginning of each session. You can then record each of the participants' total minutes for the week in the Lifestyle Coach log. This may seem straightforward, but be prepared for some common challenges.
A lot of times as a lifestyle coach, when you're trying to record the data that is essential as a part of the protocol of the program, if people arrive late to class, well, you're supposed to stop your class and go weigh them. What do? Then they slip out and you don't get them weighed. And so it takes a delicate balance. Can you multitask and keep talking to the group while you're over here? What can you do to be sure the individual gets weighed? That can be a challenge. And so for me, to be sure I got them weighed, I just keep talking to the group. I keep talking to the group and I slip to the back and say, thanks, just right. And I just keep on talking and keep it all going, but I don't want them sitting down until they're weighed. Everyone has to find their way to do that, but that could be a challenge when they slip in late and slip out early. Secondly, they report minutes to you, but they don't have them quantified. I gotta go look at this, I gotta go look at that, I'll get it to you later. Well, the later doesn't always happen unless you're on the phone saying, hey, I need that.
To assist the program coordinator with data collection, entry, reporting, and interpretation, it's important to pay attention to detail. For example, when a participant uses a fitness tracker, steps need to be converted into minutes because CDC does not allow documentation of steps. It also helps to have good computer skills.
In entering data of any kind as part of our protocol, it's awfully important to be very careful you're on the right person when you're entering the data, that you have the right individual's data in front of you, number one. Number two, that you're very careful with entry and that watching what we're doing. Sometimes we can be so accustomed to just throwing that in the computer that we can make big mistakes with just decimal points on weight alone.
Be sure to give yourself extra time to record the data. Don't wait until your data submission is due, just in case there are some technical issues you have to deal with. Contact CDC early in your program delivery if you have questions about data collection. And be sure to watch the Submit for Success data entry webinar. Keep in mind that the Lifestyle Change program can be challenging and progress rarely travels in a straight line. There will be times when a participant takes some steps backwards before moving forward again. Of course, there are many things you can do to improve outcomes. The key is to help participants overcome barriers. Try to set aside some class time to discuss personal challenges. For instance, if someone with arthritis has difficulty being physically active, have the group brainstorm on activities that won't aggravate it, like swimming or Tai Chi. You can be supportive and empathetic by reaching out to participants beyond class.
I think a lot of the success happens after the class environment, with the phone calls, with the emails when they come. Oh, here, I want to show you what I did when my activity tracker, Linda, I'm going to send it to you digitally. And when they send it to you digitally, then that dictates an immediate response. Wow, look at what you did on the third day. This is phenomenal. And anything that we do to let them keep having access to the coach, that we truly are coaches outside that one session. When you think about reaching people to make them want to come back and stay in the coaching relationship, it's not going to happen without a true intent to get beyond just the meeting. So in my view, there's so many barriers to changing behavior. If some of our coaches have joined a workout with them, that doesn't always happen, but they've said, I'll meet you for walking, just to get someone started, which is an investment of time outside the class environment. When you receive emails from the students, or when we receive phone calls from the students, just to make the call alone, we need to be very responsive to when it comes in. And if we can't, then we need to have an offer and apology as to why not. So whatever we do, the email needs to be responded to immediately, and I like to respond to something specific. On day 4, did you see what you did? Ooh, I'd love to see you repeat that. But be very specific about whatever they've sent me that says I actually looked at it. Because so many of us just check through the emails and we don't really give the attention. But if they go to the trouble as the student or the participant of the program to send us anything, I feel we have a responsibility as a coach to be responsive like that and keep on encouraging and keep on coaching and being right along their side is my view about that.
To learn more about documenting weight and physical activity and how you can help participants achieve better outcomes, watch the rest of the Lifestyle Coach series and visit CDC's National DPP website. If you have any questions, just send an email to dprask@cdc.gov. Regular participant attendance increases your organization's success in achieving full CDC recognition. You may have some participants who, temporarily or permanently, and often for reasons beyond their control, are unable to attend classes. When this happens, the right approach to take depends on the situation.
We have people who may have a boss who changes, and the boss says you can't go that hour during lunch anymore. And when those things occur, then we have to refer them to another format, like the online format. They can access it freely. So that's a wonderful alternative for those people when they can't come to an in-person program. But yes, life gets in the way for many of the divorce, personal issues, one child hospitalized. There's a lot of things that can occur, and we need to be very, very sensitive to these folks and help them find the alternative.
When these things happen, you should work with your program coordinator to see if you can adapt the delivery mode of sessions to meet participants' unique needs. Being flexible is key. If a class is missed, you can offer a makeup session using any of the delivery modes approved by the CDC. The missed session can be offered in person, over the phone, using a video conference, or through an online platform or app. During these sessions, participants may self-report their weight. Makeup sessions should be approximately an hour long and cover the key content in the curriculum the participant missed. If a participant needs to miss multiple sessions, you might suggest that the participant withdraw and re-enroll at a time when he or she can fully participate. Attendance is critical for achieving individual goals, and having to conduct multiple makeup sessions for any one participant can become a burden for the lifestyle coach. In some cases, you can consider referring the participant to another program that uses a delivery mode better suited to their schedule, such as an online format. Referral to another program is also an option for participants who relocate after beginning classes. In addition to challenges attending sessions, there may also be circumstances that present barriers to being physically active or losing weight. If this happens, work with the participant to find an alternative solution that works best for his or her situation. Sometimes it means a participant may need to leave the program and re-enroll later. Linda gives an example of a situation she and a participant worked through.
While life does get in the way of participants remaining in programs, for example, one of ours, we'd worked so hard to build activity, got her pedometer, broke her leg. And so there's a very, very bad break that involves surgery. So she was out of commission for the remainder of the program. And am I just out completely, Linda? And so she wanted an answer to that question. And so a little back and forth email going on and follow up that we can have her re-enter at another time if we need to. It's not over for her. She felt like it was over when she's just starting her progress.
Depending on the circumstance, an injured participant might be able to stay in the program and continue to be active. Someone like Linda's participant might be willing and able to try resistance bands to work out the upper body. Remind them not to get discouraged. Help them find the solution that works for them. Another situation lifestyle coaches face is a participant becoming pregnant during the year-long program. While the Lifestyle Change program is not designed for pregnant women, if a woman does become pregnant after enrolling, she may continue in the program with an okay from her doctor. For data reporting purposes, record a 998 to indicate the weight of a pregnant participant. Whether the right approach is to offer makeup classes, switch to another type of program such as one delivered online, or have the participant re-enter the program at a later time, there's always a solution that can get participants back on track. As we've discussed throughout this video series, your role as a lifestyle coach, facilitating each session and providing support and encouragement while tracking progress, is integral to the success of both your participants and your Lifestyle Change program. To learn more, visit CDC's National DPP website or refer back to any of the videos in the Lifestyle Coach series. If you have any questions, just send an email to dprpask@cdc.gov.